I'm Judy Shaw for NYSE Floor Talk, and I'm here at NYSE Pacific. Joining me today is Carolyn Witte. She is the co-founder and CEO at TIA. Carolyn, it's wonderful to have you here. Thanks for joining me.
It's great to be here. Thanks for having me.
My pleasure. So now, Carolyn, talk to me about TIA. Tell me about the company and what's your mission.
Sure. So TIA is a new standard of care for women. We're completely reinventing everything about how healthcare is thought of, conceived of, and delivered to real women in the world. And our mission is to enable every woman to achieve optimal health as defined by herself. And when we say optimal health, what we mean is more than just treating sickness, actually supporting women get in stage really well. We mean defined by you, not just the healthcare system or an insurance company or whatnot, but actually centered on real women in the world. And we mean treating you as a whole person, not a part, not a body part, an ailment, a positive or negative pregnancy test, but optimal health for women as whole people. And we're on a mission to bring that new standard of care to all.
Carolyn, tell me, what differentiates you from other healthcare providers?
So 4 core differentiators that make TIA a very distinctive new standard of care. First and foremost, we are rooted in prevention-focused primary care. 50% of women in this country don't have a PCP, which means they're overutilizing specialty care, which drives up costs. It's a bad experience for women and worsens outcomes. So we address that preventative care gap by giving women the first and only women-specific primary care provider. Second, we go deeper than a typical PCP and support women's whole health across their lifespan by layering in other services, gynecology, mental health, and wellness to support women's reproductive, physical, and mental health in an integrated model. Third, we're accessible. We take insurance. So we have a different style of care that treats you as a whole person, a beautiful, amazing experience. But we work with your insurance company like a typical doctor's office. And this is really differentiated when it comes to next-gen providers and is key to our access goals, helping more women get access to TIA. Lastly, the way we deliver care across both virtual and in-person retail-style clinics that meet women where they're at in their daily life is a differentiator. We're not just a content play or a coordination play. We're actually your doctor, right? We employ clinicians, train them to deliver this high-quality care, and build our own brand new clinics that make healthcare an experience you actually want to interact with and engage in before something is wrong. So to summarize, our core differentiators are primary care, the breadth and depth of our whole woman, whole life care offering, the accessibility through insurance, and the hybrid virtual and in-person care offering make TIA stand out from the other players in the category.
All right, now as you look to the next 12 months, tell me, what are you focused on? What are your priorities?
2 things that I think about in tandem. First and foremost, clinical quality and proving that this new standard of care we've built makes women healthier. We're really proud of our amazing clinical outcomes that we've proven to date and continue to focus on quality as we enter the scaling phase of the company. Second is economic durability. Pairing quality with economics in healthcare, specifically primary care, is really, really, really hard. And we're proud to have a really strong economic model that is so critical to enabling us to bring and scale this new standard of care for women to all. So quality and economics for women at scale is the core focus for us over the next couple of years.
And finally, one last question. You're co-founder of TIA.
Yes.
Tell me, what sparked you to start the company?
I started the company very much because I was a patient who experienced and experiences, frankly, all the pain points that we seek to solve at TIA. I didn't have a primary care provider. I had all these different health issues, physical, mental, reproductive health, and I saw all these different doctors who didn't talk to each other. And it took me multiple years to get diagnosed with a chronic condition that we diagnose our patients with all day long at TIA, called PCOS, and got to the end of that journey and said, wow, like if I can't navigate this healthcare system, it's so fragmented, it's so broken, it's not oriented around women, what does anyone else do? What if I could create a new standard of care that treated women and treated me as a whole person? And that was the spark that got me to start and ultimately build TIA to what it is today.
All right. Well, Carolyn, wonderful to talk with you. Thanks for joining me on Floor Talk today.
Thanks for having me.